Welcome to Biomedical Bits. I am joined today by the very accomplished Dr. Delia. How are you doing today?
I'm good, thanks. How are you?
Also really good. I'm really excited for this interview because not only are you very accomplished in materials engineering, biomedical engineering, and now plastic surgery, but you also have changed your career path a couple of times. And I think listeners, regardless of their background, are going to benefit from hearing your story today and are definitely going to learn something from this interview. So thank you for joining us.
Oh, thank you for the kind words.
For context, if you're not familiar with Dr. Delia's work, he has started his career in the field of biomedical and materials engineering. Halfway through that degree, he switched to medical school and is pursuing now plastic surgery.
That's right.
Within that time, he also published 15 co-authored medical research papers before the age of 25, and they branched across materials engineering, biomedical engineering, and plastic surgery. But I want to start taking it back to the very beginning. So when you were a kid, what did you want to be when you grew up?
Ooh, that's a good question. When I was a kid, I don't think I wanted anything to do with the hospitals. Hospitals were the last place that I imagined myself being, so it's been quite a shock to grow up and realize that's where I'm going to be. Growing up, I actually was very interested in theater, and I really wanted to be an actor. I had big dreams, like probably the rest of us. And then I think along the way, I kind of became the kind of like tech savvy person in my family. I was the person that everybody called if they needed help with the phone, the internet, the TV remote, whatever it was. And so that kind of got my, interest kind of jigged into like engineering and inventions and stuff like that. So, my growing up, I never imagined I would go into medicine, be a surgeon, anything like that.
Were you one of those kids who was grossed out by blood and guts, or you were just a generally curious child?
I remember thinking about the hospital as kind of like a gross, smelly place that I never wanted to work in.
I think that's a really normal reaction too, because for most people, the hospital is a very negative place. You're only going there when you're not feeling well, when you need a treatment, when you have a family member who's ill. It's not a natural place to gravitate to, that's for sure.
Absolutely, I would agree with that. It was always kind of shrouded in a negative light.
Did anyone in your family or your close friends come from medical field?
I think I'm a third generation immigrant to Canada. And to my knowledge of my extended family, there's not really anybody in medicine back in Italy. Unfortunately, there was very little kind of, I would say, influence or mentorship that I had kind of going into this career. I've definitely, forged those relationships along the way and found people that have supported me. But up until this point, it's been a little bit of like a lone wolf kind of adventure for me.
I definitely understand that as well. So you, over time, grew an interest in technology, and you said that fueled your interest in engineering. When it was time to apply for universities, did you only apply to engineering programs? What kind of programs did you apply for?
Yeah, actually, the program that I went into, Integrated Biomedical Engineering and Health Sciences at McMaster, it was one of the two engineering programs that I applied to. I applied to, I believe, 11 programs across Canada, and all of them were more like the health sciences, biomedical sciences field. Engineering was a bit of like a late discovery to me, for me. It was not something that I thought I would go into. I had interests in it, and I knew that I liked, taking things apart, putting them back together. And I was kind of looking for something that was going to leave the most doors open. I know one thing about myself, it's that I'm indecisive. And so, delaying that decision or getting to explore more before choosing my career path felt like something that was very enticing to me. But anyways, yes, to kind of go back to your question, biomedical engineering was kind of something I was looking at, but I was really kind of using it as a tool, I would say, to figure out where my passions in health sciences lied originally.
It's interesting you said how it also came from an indecisive motive, because biomedical engineering integrates engineering, which integrates so many other subjects like physics and chemistry, and then you have the medical aspect on top of that. For me, and it's also very common that I hear this, is that biomedical engineering is a mix of everything, and it's where everyone who's indecisive about picking one thing ends up. But I think it's also a good lesson in that when you're young, discovering a lot of different things and being open-minded to how your career path can change is definitely important. I think in today's day and age, there's a lot of pressure on young adults to pick their direction and stick to it. So it's very interesting to hear how you let it sway you throughout. You had not yet finished your engineering degree. When did you decide you're going to step out and pursue medical school? How did that process look like for you?
It's a great question. And I think, the path that led me towards medical school wasn't straightforward. And part of because it wasn't straightforward and because so many things kind of aligned, it was kind of like this momentum that had built. So I made the decision on very much on a whim to apply to some of the programs that I qualified for. There weren't very many at the time because I was a student coming out of third year and I hadn't taken a lot of the courses that some of these medical schools require. So I had only applied to a couple of schools, but nonetheless, I want to see how far I could get in the process. Having no real kind of mentorship or family connection or anything like that. And it was in that application cycle that I ended up getting an interview to the University of Toronto. And thankfully, the interview had gone well. I didn't think it did, but it must have. And I got accepted into my third year of my undergrad.
Okay.
It was just, an opportunity came knocking. And I was kind of beside myself to say no when that opportunity kind of knocked. And so I took the leap of faith. I decided to, end my undergrad early and pursue medicine, knowing that I could always return to engineering in the future if I really felt that way.
There are many people who decide when they get to first year, second year, third year, that they're not in the right program, they're not doing the right thing. This can also apply to even later in your career. You've established your career and you've decided this is not what I want to be doing. It takes a lot of courage to take that step. Did you ever have a moment thinking it was too late?
Oh, definitely. I do think back to my times in my undergrad. And I wasn't super fulfilled when I started that program. And I couldn't appreciate the value of what I was learning at that point in time. Not to say it wasn't valuable, but it just wasn't satisfying me personally. We got further into the degree, I kept thinking, oh man, like I'm wasting time doing something I'm not really interested in. And I, looking at this other specialty, this other field that is doing incredible things, I wanted to do that too. I have felt like, I didn't make the right decision, that I was running out of time, that perhaps things were too late for me. And I think it's in those moments that you really have to stop, pause and say, okay, what is it that you're actually thinking about? Is this a grass is greener on the other side moment? Or is it something that you're genuinely really unhappy about? And it does take a lot of courage to make that change and kind of, assume some of like the time wasted that would happen, to kind of claim that. But I think that if it really is something you're unhappy about, if it's really something that you can't imagine yourself doing, it's worth just even making a couple phone calls and seeing where that would take you.
Are there any skills that you learn in engineering that you think better equipped you to pursuing medical school?
Yeah, for sure. I would say it was even a bit of a selling factor when it came to medical school applications, residency applications, into my field of interest now. Engineering can teach you so much, not only about yourself, but the world. And it can give you like a real skill set that is something to be admired. I think that engineering really teaches you how to approach a problem from the ground up, how to work with humility and realize that you need to work in a team. It's not going to be you in isolation that is going to save the world, right? It's going to be a team of people, all with different backgrounds, all with different skill sets. And so I think teamwork was a big piece of this that I don't necessarily think people get in other disciplines right off the bat, simply because engineering is such a project-oriented field where really you are trying to take what you've learned and apply it in a more practical way rather than stay more theoretical, which I would say, some more traditional science degrees tend to do. So I think engineering from that perspective really helped me because medicine is a very interdisciplinary space. You might go to medical school and learn, everything from OB-GYN to surgery to family medicine and pediatrics, but you end up specializing. And so all the time we are relying on each other to, provide input, advice, provide expertise about a particular thing. I think the second piece that was kind of more applicable later on as someone who's interested in surgery was definitely like the hands-on part of it, the creativity part of it, the part that comes with, innovating and prototyping and all that kind of stuff. So, the hours that I used to spend in the design studio, 3D printing things, soldering things, gluing stuff together, and, trying to create something from the ground up really has direct parallels to the surgical world, especially in plastics, which is a very creative field. You really are trying to make something from nothing. I think engineers belong in medicine and they have a very important role to play. They're often the leaders of the teams that I see in the clinical setting too. And so, yeah, I'm very grateful to have pursued that path before going into medicine.
Following medical school, why did you choose to pursue your residency in plastic surgery?
It's a great question. It's a question that I continue to explore myself. The biggest kind of pieces or influences that led that decision really had to do with like my previous interests and background in biomedical and materials engineering. So my entire research background, all the way from the beginning of undergrad, was trying to restore the body. And interestingly, the whole philosophy behind plastics and reconstructive surgery is to restore form and function. I saw right away the connections that were being built between my past life as materials and biomedical engineer and now as a surgeon. And I think that only grew as I ventured into the field even more. I saw how creative it was. I saw how plastic surgery is a special place where there's no one way to solve a problem, because exactly what we see is exactly what we were taught in engineering school. And I just found that so incredibly satisfying and interesting and full circle, especially being someone that felt like they left engineering a little bit early and wanted to see it through. I think those were the major drivers behind my decision to go into plastics and reconstructive surgery.
For those that don't know, what is the difference between cosmetic surgery and reconstructive surgery in the realm of plastics?
For sure. The thing about plastics and reconstructive surgery is that a lot of people envision it as a cosmetic field, right? That was the answer, or that was the comment that I always got from friends and family whenever I told them that I had matched to plastic surgery, was very much about the cosmetics. And it's so much deeper than that. It has such far-reaching impact on people's lives, especially patients that have undergone traumas or have been diagnosed with cancer and need resections. And then, there's huge lumps of tissue that have been removed from them that need reconstruction, or hand surgery, or people that have had injuries to the skull or face or things like that. And cosmetic surgery is a discipline that is dedicated to improving the human form in a way that would satisfy a patient's personal wants and needs, right? These are usually patients that come to the surgeon feeling insecure about themselves, or maybe wanting to look a certain way compared to what they look currently. And so it really is a field that is about a quality of life improvement rather than, life-saving surgery. The reconstructive side really has to do with patients that have disease processes or have sustained traumas in the past and require reconstruction to kind of restore whatever form or function that they've lost. In traumas, you could have someone who's, broke their wrist, or has severed nerves that are powering important muscles responsible for eating or drinking or holding a pencil or any of the above. As plastic surgeons, reconstructive surgeons, we are trained to be skilled in restoring those functions. So reconnecting those nerves, or recreating portions of the wrist, or trying to stabilize the wrist in a way that would allow someone to still glean meaningful function from that part of their body. Then there's a whole part that is related more to cancer reconstruction. In patients that are lucky enough that we can take whatever tumor out surgically, we need to think about what we're putting in its place, because we don't want to leave a patient with a massive defect or wound in their body that won't heal properly. And so we're also experts in, how we can move tissue around the body to recreate or restore that.
Mm-hmm. And that's very important because in the element of dysmorphia, say you've recovered from a cancer, for example, even seeing your scars would be a constant reminder back to those traumatic times. So in that sense, reconstructive surgery is really beneficial for their mental healing moving forward.
Absolutely. What an impact it has on that person and how they see themselves, how others perceive them, how they're able to reintegrate with society without constantly having that in the back of their mind. It's a really gratifying specialty in that way.
You've obviously had a lot of patient interactions throughout your career so far. Is there one patient interaction that really sticks with you that you think about often?
There are so many patients that come to mind. Interestingly enough, this is not a patient that I saw in my plastics and reconstructive surgery rotations, but it was a patient of mine who I was looking after on the general surgery ward. And I remember they had come into the emergency department having difficulty holding down everything that they were eating and drinking. This is a patient who had gastric surgery in the past because they had gastric cancer. So they had part of their stomach already removed in the past. And I remember just wanting to be super optimistic that it was still gone. And unfortunately, after many days of waiting and many tests, we decided to take them to the operating room to take a look with our own eyes what was going on. Because unfortunately, scans and scopes and other things that we were doing to try to figure things out wasn't enough. I was hoping that that meant that there was nothing going on, but unfortunately, what it meant is that the cancer had spread to other parts of the body and was up where it was applying pressure and causing their symptoms. And I remember just working with this patient and seeing them day after day, and thinking to myself how crushed I would be to have that diagnosis. This was something that he had already fought and won against. And to have that diagnosis, I think for me would have been totally crushing. I don't think I would have handled it as well as they did. He was such a positive man. When I would go in there, he would ask me questions about, how my finances were because he used to work for a bank. And I remember instead of the conversations being about, his diagnosis, which of course was very difficult, though necessary, and we do have to have those conversations as well. He was giving me financial advice and telling me which stocks to invest in and telling me, which accounts to open so that I was in good shape in the future. And I found his spirit so uplifting, despite having such a difficult diagnosis. He had such a beautiful kind of energy. He really put life into perspective and be thankful for everything all the health that you have. And it was such a pleasure to work with him. I saw all the goodness that can come with even a very difficult scenarios. And I think, it's truly just a privilege to be part of like a profession where you're able to be part of that and observe that.
That's a really inspiring story. You're inspired in some sense to go to work every day, whether you're tired or fed up, because you know that someone's relying on you on the other end. And I think it's a really special part of our profession is that patient-human interaction. And it's something that I really appreciate about our field. Thank you for sharing that story. The journey through biomedical engineering and then medical school and now residency, and there's other steps to continue as well.
Many steps to go.
It's a long educational journey. Is there any advice you would have told your first-year self today, looking back?
Oh, wow. Yeah, I think there's a lot of lessons that I've learned over the years that I wish I had probably known a little bit earlier on. I think the first is this idea of imposter syndrome. So I think to keep it pretty brief, it's important to remember that chances are you are there for a reason. I know that there are many times throughout my journey where I had a huge amount of self-doubt. Look for the reasons why you did earn your way to the place that you are at today. And so I think one thing I would tell younger Andrew is, yes, you are here for a reason, even if you can't appreciate that at the time. The second thing that I would say is you tend to kind of get in this habit of looking for external validation and constantly chasing whatever that next thing is. So back in high school, it was doing really well in my courses so that I could get into university and get into the program that I wanted. And then when I got into my university program, it was about getting into medical school. And then once it was medical school, it was getting into residency and, plastics, reconstructive surgery is known to be a very competitive field because there's very few spots. I guess you could say cycle of constantly being in a position of needing to achieve something and then achieving it and then needing to achieve something and then achieving it. There were many times where I could see that I was wrapped up in, what my grades were or something like that. And I think that part of that took away from the experiences that I could have had at each stage. And I don't think that would have changed where I was now if I, enjoyed the moment a little bit more, if I spent a little bit more time with my friends and family. And so you can skip entire decades of your life and, wake up and wonder what happened along the way. So I think really sitting in the moment is an important skill to learn. It's important to kind of take a deep breath, come up for air every once in a while.
That's really good advice. Remember to celebrate even the little things as they come. And it speaks to your point about coming up for air and kind of looking around you, looking at what you've achieved, looking at where you are today. Failure is such an important part of learning. It's a reflection that you'll take forward in the rest of your career as well.
Definitely. I would echo that. Failure is important and it's not something to be afraid of. It's also not something to personally identify with, but it is a tool that you can use to get better. So it's important to look at it that way.
Absolutely. You have been very involved in research, as we've discussed in this interview. I wanted to go in and discuss one of your recent publications in the realm of plastic surgery. We do have an audience from different backgrounds, so I was hoping we could go into explaining what the research paper was about, what your involvement in it was, how did you conduct the research, what were the results, implications, and just shed light on this important paper that you've contributed to. The title of the research publication was Bioengineering of Vascularized Porcine Flaps Using Perfusion Recellularization Techniques. So in summary, you took pig tissue, you extracted it from the pig specimen, you wiped it of pig cells, you then recellularize it with human stem cells for then human implantation later on. Is that correct?
You heard it here first. That was better than I could say. It was a true privilege to be able to work on that project. The premise behind the work that we were doing was trying to create a new source of tissue for reconstruction of the human body. So as I mentioned before, sometimes patients are in traumas or they have massive cancer tumors that need removal, and these leave potentially large defects in the human body. These defects can be very debilitating. They can lead to huge issues with form and function in the future, and that's why they need addressing. The ideal situation in a lot of these circumstances is we borrow tissue from other parts of the body, right? So a common one that we see a lot in breast cancer, for example, is after the breast tissue is removed, we actually replace it with part of the stomach or like part of the fat overlying the stomach. But that's one of the workhorse flaps that we say now these days. And a flap is essentially a unit of tissue we unplug from its original blood supply and plug into a new blood supply somewhere else in the body. The problem is that in certain cases, like really large traumas where a huge amount of the body is affected, it can be difficult to find that amount of tissue from other parts of the body without causing other issues in those areas themselves, right? And so the question becomes, where do you get that tissue then? Where do you find the materials to reconstruct the body? In those cases, we look at artificial tissues, like things that have been bioengineered. The issues with going to animal tissue is that, of course, animals and humans are different. Their cell makeup is different. That makes a huge target for the immune system to get involved.
Right.
And so you can imagine that if you were to take part of a pig and use it to reconstruct part of the human body, it would, over the course of even potentially minutes, get rejected from the human body. And so the idea behind this is, can we target the parts of the pig tissue that are the most immunogenic, the things that are going to set off the alarm bells for the immune system in the human? One of the most immunogenic parts of any piece of tissue is the skin.
Okay.
So in this project, we looked at decellularizing them to remove the cells from, I guess you could say, the mesh work or the spider web that kind of connects the cells together. If we can get rid of the cells, then we can reduce the immune response. So we were able to successfully do that using a series of decellularization steps.
The decellularization process, it will preserve the overall structure scaffolding of the tissue.
That's right. Yeah.
And it only takes out cells that will result in an immune response for the human body.
Ideally, yes.
Okay.
So certain soaps or detergents, so the idea is get rid of all the cells, get rid of all the immunogenic portions of that piece of tissue, and leave behind just the meshwork, just the scaffolding, so that human cells can replenish that space and grow into that space. So we were able to successfully decellularize a variety of different muscle flaps, connective tissue flaps. The second piece of that, of course, is the recellularization step. So this is a part that's a little bit more novel. For the sake of our project, we looked at recellularization of just the vasculature, just the inner layer of the blood vessels that supply this flap. Those are the most important to recellularize, you could argue, because those are the cells that are responsible for limiting the potential for blood to coagulate and stop flowing.
Because when that flap is implanted into a human, the vasculature within that muscle you're transplanting also needs to connect to the vasculature of the human.
That's correct.
We can touch on that. So your recellularization process, you put human stem cells back into the pig tissue. Can you explain a little bit more about that process?
Yes. So I believe in this specific paper, we used human vascular endothelial cells, or HUVEC cells. So that's the first thing to consider, as well as your cell line selection. We also used fibronectin, and essentially what this does is fibronectin is a protein or a cell marker that allows the cells to stick better. to the vascular walls.
You can't just input all of that back into the tissue scaffold and expect it to maintain its structure.
Exactly, right? So fibronectin was something that was published in other protocols for recellularization as a step that would help assist with cell adhesion to the walls. The process of actually seeding the cells into the vasculature is something that is a protocol we developed. Oftentimes it involved slow pushing cells through a syringe. The cells were suspended in a media to like keep them healthy, to keep them supplied with nutrients so that they didn't die. And we did this all inside of a fridge that kept the tissue at 37 degrees or body temperature, so to speak, to try to recreate the environment that cells normally live in. And what we saw was that the major vessels, the ones that we were able to biopsy and take a look at under the microscope, did have a level of adhesion, and we could see cell colonies that were forming, which is, again, what I would argue is the most important piece of recellularization for purposes of ensuring that the flap survives.
You're also touching on the point that medical research takes years and years of building pieces on top of pieces. We cannot just extract a tissue from a pig and put it into a human. There's steps even within the basic 3-step process that you discussed previously, where you extract the tissue, you decellularize it, you recellularize it, and then you put it into the human. Each of those steps has multiple steps, as you're touching on.
Absolutely. Absolutely. It takes decades for some of this research to come through. And I know for a fact that this project took several years before it ever crossed the finish line. I was lucky to even be just part of it in some way, shape, or form. I helped a lot with the surgical procurement of these tissues, as well as the decellularization steps. And of course, like imaging and testing of our results as they came out. But you're totally right. Each one of those steps in and of itself is an entire PhD or field of research behind it. What works for one tissue, which might be comprised of muscle, which we had a really hard time with, is not translatable to skin, for example.
Right. And this is even just to work with a tissue that hasn't interacted with the human patient yet. I'm sure there are other researchers who are in parallel trying to solve this problem using synthetic materials, materials made in the lab. In your case, you're using animal tissue to start your scaffold. In your opinion, why would it be better to implant a muscle tissue as opposed to trying to synthesize one from scratch?
I think one of the biggest advantages to a decellularization, recellularization model is, again, that conservation of that scaffolding.
When fine details matter so much in a case like this, what was the decision behind pursuing pig tissue to be used in humans?
Yeah, I think, so first we know we are quite experienced like within medicine with pig tissue as compared to other animals, right? Pigs in general are one of the closest genetically to humans, right? And so, choosing something that is genetically similar to humans is advantageous from the perspective of eliminating potential immunogenicity problems. The further you get away, you can anticipate that you're going to have more genetic mismatches that might trigger immune responses, might trigger some sort of rejection to occur. So trying to get as close as you possibly can is important. And I think the other influence is probably just history. A lot of prosthetic valves that are used in cardiac surgery are decellularized pig valves.
That provides a great context. And you also mentioned previously that you helped in the tissue procurement processes for this. For most people, the only context they have to surgery is from TV shows like Grey's Anatomy. But take us into the OR with you. What's all of that look like? Taking
you into the OR with me, it starts outside preparing. So that means preparing your surgical tray. It also means preparing all of the little spots where you're going to collect your samples. And so all of that process starts hours before the OR. Then you get dressed up, of course. You're going to be in scrubs for this event. And you're taken to the OR. The peg is already kind of on the table. And we have an entire team that's kind of dedicated to making the pig comfortable, making the pig feel safe, easing any anxiety that the pig has before an operation like this. So we have a team that's responsible for anesthesia, pain control, making sure that anxieties within normal limits and that the process is humane. And then once the pig is asleep and we're all set up in the OR, you're scrubbing in, making sure everything is as clean as possible. We designed an incision that we knew would get us to where the muscle that we wanted as soon as possible. And then really it's about using first principles of surgery. So trying to identify your vasculature, making sure to keep that protected while you're dissecting the tissue away from other pieces and trying to isolate the piece of tissue you want from the rest of the body. I mentioned, a flap is a unit of tissue that's unplugged from one spot and then plugged into another.
Yes.
And so to facilitate that plugging and unplugging, you really need to isolate that vessel really, really well. So we trace that vessel all the way to its source as much as we can, try to get as much length as we can before it branches off into some larger artery
Right.
Or vein, and try to clip it there so that we have lots of length to work with for purposes of plugging it in to be perfused and decellularized, or in one case scenario, eventually being plugged into the recipient vessel of the human.
Really interesting. We often hear that there is a generational gap between new tech and new method adoption. Understandably, if you've been practicing in the field for many years, it's hard to go back and adjust what you're used to. So we often hear that there's a generational difference between tech adoption in new employees and in old ones. Do you notice that in surgery?
That's a great question. I would say yes and no. It really does fall on the surgeon to kind of either go with the flow of new technology, new techniques, new advances, versus kind of stick to things that they are more comfortable with. I think ultimately the most important thing to remember is that these are patients at the end of the day. And, as long as we are providing treatment and care and using techniques that we know will accomplish the goal that we have for our patient, that's the most important thing. Whether or not it's done with a robot or by hand doesn't really matter as much in my mind.
It would be inspiring as well to be in an environment where everyone's kind of rooting for the same advancement, improving patient care. And at the end of the day, that's what you're all there for.
Totally. Yeah.
I'm not sure how well you'll be able to answer this question. AI adoption, like tools using ChatGPT, for example, came into effect probably around the same time you were in university. And now you are experienced working in the field. How did those AI technologies impact medical school experiences and current hospital experiences that you observe today?
Yeah. Yeah, I would definitely say that large language models, AI, things like ChatGPT have really turned the field of medicine on its head. I think that originally when you hear of these technologies, you might imagine that there's a lot of pushback. But I think that the field of medicine has really tried to take it in stride instead of fighting it and adopting it and trying to investigate ways that it can be helpful. It's definitely been a huge educational tool. It really helps to summarize and consolidate information, but it certainly does have its dangers because it can hallucinate, it can create or fabricate information that's not true. And so I think that it's been a tool to use once you have a sufficient level of foundational knowledge. My next point, which is kind of about how the field has kind of been trying to adopt. And so we have the parts of AI that are being investigated for automation of different surgical procedures, for example. But there's also
imaging analysis.
Yeah, an imaging analysis for sure. I think similar approaches are being taken when it comes to any new technology, which is making sure that you're doing the due diligence to validate that this is something you can trust or that you can depend on before putting it in charge of patients' lives. But I do see the value in it. I can see it being a helpful educational tool. I can certainly see it being an effective and helpful part of the screening process for things like imaging. Whether or not it completely takes over jobs, I would say is difficult to say. And I would say probably not, but it's certainly that has turned the field on its head.
In general media, we are seeing some fields freak out about it, some fields readily adopt it. So that's great perspective and definitely an inside lens to how it's working for you and your colleagues as well.
Yeah, definitely.
Do you remember a moment where a biomedical engineering concept blew your mind?
Oh God, every day.
Every day.
Oh, it's such a good question. I won't say it's the first one that I ever experienced, but the first one that comes to mind, and it was my work at the Princess Margaret Research Institute. I was working under the supervision of Dr. Gang Zheng. His lab focuses on the fabrication of nanoparticles, which is a fancy term for really small, tiny objects. The project that I worked on was actually kind of using technology very similar to that in the COVID-19 vaccine, but repurposing it to not only be light sensitive, but also target cancer cells instead. The medication inside of it was actually a gene modifying medication. So it actually works at the genetic level to change the factors that are responsible for making a cell behave in a cancerous versus non-cancerous way.
And what is the significance in that context of them being photosensitive?
Yeah, so It's a great question. One of the greatest advantages you have when something is photosensitive is that you can make it a targeted therapy. So this is something that can be put into an IV, put into the bloodstream, and the bloodstream is going to bring it everywhere. But if you use a light source, you can actually give the human body kind of like an antenna of where that medication should go. So if you bring the light source to the cancerous region, you can actually target those cancer cells, which is really interesting.
And that would definitely be a biomedical engineering aha moment
Yeah,
for most people, I
totally,
think.
totally. It was very difficult to learn, I will say that. Reading the papers was dizzying, and you can just tell how much work and expertise goes into a field like that. So it was just such an impressive project, and it was a real pleasure to work on.
You mentioned the amount of literature and learning that you had to do to execute that project was dizzying. In a lot of situations in engineering in general, you're stepping into scenarios that have never been solved before. There is no answer, which is why you're there to solve it. Do you have any advice for people who are timid of putting themselves in those situations?
It's a great question. I think like one of the biggest pieces of advice that I have is that you have to get comfortable with being uncomfortable. There's never going to be a time where you walk into something that you know nothing about and you're going to feel comfortable about it. That's not possible. It just doesn't make sense. But what you can do is get used to that feeling and build a toolkit for yourself that you can use to gather your bearings in that situation. You know, what kind of information do I need in order to start making thoughts or ideas about the topic at hand? It can kind of help ease the transition into that new space. I think also reminding yourself that everybody that enters that new space experiences the same thing.
That's really great advice.
Thank you.
You are obviously coming across a lot of technological advancements in your day-to-day job. What would be an overlooked medical problem that engineers should solve?
Currently in medicine, there is still a huge problem with access and with, I guess, equitable access at that to medical care. I think it comes from the perspective of like human resources. Like there's a huge shortage of doctors right now. And I think that as we create, technology that is intelligent and that is able to, actually in some ways, not always, but in some ways think for itself and generate solutions to problems, I would love to see what can be done in the way of ensuring that we are strategically distributing resources across the country. I think that one day medicine will also be more remote. We'll be able to access patients in more remote communities of the world and even treat them, like things like telesurgery are upon us and things like that. But we're still quite a ways away from that.
Great ideas.
Yeah, we'll see.
Go solve them in all your spare time.
Yeah. I'll just do that right after this, I think.
A last question that I love to ask people is, what would your 80-year-old self say about you today?
Oh, wow. It's a great question.
How would that conversation go?
I think 80-year-old Dr. Dalia is going to look at current Dr. Dalia and, probably, I would hope to say that they're proud. I would hope to say that they're impressed. I think that my 80-year-old self would probably be trying to console current Andrew through a lot of indecision that comes with being at a point of flux in my career, hopefully patting me on the back for doing a reasonable job at getting through it. But yeah, that's a great question. Hard to say.
A very theoretical question. We have gone into details today about your career path, all the changes you've made. We've gone into details about one of your recent research publications and hopefully provided more context to people who are in our field and people who aren't. Thank you so much for your time today. It was a pleasure having you for an interview.
Well, thank you for having me. I hope everyone took something away from that.